I'm going to talk about the country readiness to introduce MMS and scale. And I will basically be going through the phases that you have presented to us. So four main points. First, we'll talk about the phases of MMS implementation. Then we will talk about the mapping of country progress as we do it at HMHB. Then we will talk about the mapping that you have done, and then we will bring it home with the marketplace. That's what I was already talking about. And I'm sure many of you have already seen this slide in one way or the other. It has been spoken about a lot, so I can be very brief. Basically, when your country goes into introducing MMS and deciding how to scale it, you go through these three phases. Initially, you are exploring. You are thinking, is it something for us? Do we have evidence? What is the guideline saying? What do our policies say? You are looking at perhaps conducting a landscape analysis. If you're convinced, you move to the next phase, which is the initial implementation phase. And here, you kind of have a small strategy, or can be big, and you're testing that strategy. You use various methods, implementation research. WHO has called for implementation research to try and check various contexts that exist in your country, how MMS performs in those contexts. Some people come from very tropical forest kind of zones. Others come from arid and very dry places. Others come from very mountainous places. And you can agree with me, the way you deliver these products to these places will be determined by your context. When you have managed to get the questions that you have locally answered, now you move to the scale-up phase. This is where now, together with the national office, you do a lot of planning, robust planning. You do your costing of your roadmap. You find partners who can give you the resources that you need, product but also financing. You advocate locally for domestic financing, and then now you can scale up. So those are the three phases. And just very quickly, in the exploration phase, when you're trying to build a neighboring environment, you conduct landscape analysis, you do exploratory studies, you have a lot of partners in multiple corners of the country checking different things, but centrally coordinated. Some people, it's the national MMS tag. Some people, it's a national MMS task force. All these task forces, their main job is making sure that they take all the information coming from the corners of the country and help understand what is our nutrition situation, what is our issues to do with policy, how are we regulating MMS, how are we delivering MMS in various places. All this, we call it landscape analysis. And you do that by gathering a lot of data to demonstrate demonstrate need for use of MMS. You are able to show that even places where, for instance, you had challenges with coverage of even IFA, you are checking, will we have the same problems with MMS? So you are trying to check whether you can overcome the challenges that IFA, for instance, had. You are looking at who are the stakeholders. Perhaps that's also why you are in this meeting. You're trying to look who are the stakeholders beyond borders that we can engage with. You are trying to build consensus locally also in terms of how do we transition from IFA to MMS. We heard from Malawi, for instance, how they found out that, well, even as we transition, we have to think about our adolescents. These are questions that come up around this phase. You are trying to advocate for inclusion of MMS in the national essential medicines lists. And then now you go to the second phase where you can do formative research, implementation research. You can test your plans. You can test your procurement and logistics of national supply chain systems. Some countries, I heard in earlier session, somebody mentioned central medical stores. Some countries have a devolved system of supply of medicines, and you have to check whether your system can manage all this. And then now you scale up. And in scaling up, you're talking about capacity building of your healthcare workforce. You are talking about monitoring and evaluation. You heard people talking about data. How do we make sure that MMS indicators are also being captured? You talk about your social behavior change communication plans. You try to fine-tune them for the country. And now here, you are very serious about financing because you know once it becomes a national program, there is the advantage that it's sustainable, but it also needs to be resourced. So at HMHB, we maintain this map that we try every year to get feedback from partners, all of you in the room actually, any of you can write to us and tell us this is what we are doing in our country. And we just talk with you and then we upload it on the website so that any other partner can click that country and see in Nigeria, these people are doing this in this state, and therefore if I want to engage with them, they can reach out to you. What we do when you fill out the survey that we send out, we categorize the status of the country where you are. You could either be in the very early stages where information is available but there is no active implementation, or you're in the exploratory phase, or you're in the initial implementation phase, or you're in the scale-up phase. I'm only showing this so that now, and I apologize if this is not, I hope it's clear. On this table, and I think this is the second last table, what we are showing is on your extreme left, facing this side, you have the countries represented in this room. The countries that responded to the questions that we sent through the questionnaires, and you sent us the presentations. You, in the middle, you reported yourself where you think you are in terms of the scale-up. And so you can see, and Burkina Faso, I love Burkina Faso. I'm just going to use you as an example because you are alphabetically at the top. So for Burkina Faso, they told themselves that they are phase 3. And phase 3, that would be scale-up phase. So, but when we went through the presentation, on the extreme right, you see our ranking. We thought, yes, you have done a lot of work, but we actually think you're in the design and testing or implementation. You're testing implementation strategies. When you go into phase 3, there will be other, this is, by the way, there's no wrong answer. Your answer is correct, our answer is correct, and we can agree to disagree. This is a discourse. We shape it as we go. If you look at Côte d'Ivoire is, by the way, our guest in this meeting because they are in that very gray first phase of we are here to learn. They are where some countries were last year when they came to Addis. So that's why we say they are in the information available on MMS because their national leadership has been attending meetings and knows about it, and that's why they are here. So they have the information about MMS, but there's no active implementation. If you look at the DRC has been doing a lot. They say they are in phase 3. When we looked at what we were comparing what we have in our tracking versus what they sent us also in the presentations, and we think they are also in the second design and testing implementation strategies phase. So what you see here, if I was to summarize this slide, most countries have moved from last year. Last year, most countries were in the information of where Côte d'Ivoire is, apart from Ethiopia. Ethiopia is a special case, and Nigeria. But most countries were scoping. I do recall last year, even Kenya came when they were at that stage of information available, but we are not doing anything yet. They heard a lot. Since then, they have made a couple of strides. And you can see now they even have a task force. So they are still in that stage. They're not yet having active implementation. But the fact that they have a task force, there are countries that we have marked there that they have a national technical advisory group or a national task force. What we have seen is that as soon as a country forms a national task force, in the next 3 to 6 months, they make very many steps. We saw that in Malawi, we saw that in Nigeria. I know Ghana has also just formed a national tag. So that's why we are spotlighting these things. So this just shows you that you could either be in phase 1, phase 2, or phase 3, but actually these phases overlap, right? So it's possible that for one region, you might have 3 different partners in one region, call it the coastal region of your country, and the 3 different partners are testing three different phases of the same thing. So it's a bit organic. So you have to see it in its context.